fight infections.
All the health professionals who have been doing tremendous work across our province, the security officers, our police, our traffic officers, our soldiers who have been working very well. And one thing I particularly want to say is that in the last few weeks, we haven't been seeing, few days, there's been improvement. We haven't been seeing images of abuse of the lockdown by our state security agencies. We work with them very closely. Yes, they get the message from national government, from the national ministers and the president, but they also get the message from us, our metro police, our traffic officers, our police service officers, and our soldiers are responding well. They are able to respond well to the need not to abuse the authority that they have, but to enforce the regulations fairly and firmly without abusing the powers that they have. I want to call on the people of our province to continue to help us because we are very, very far from flattening the curve. We want to join the Minister of Health, Dr. Mkhize, in restating that we shouldn't think we are over it yet. We should prepare for the worst and hope for the best. Everything we are doing, we don't want complacency. We don't want to start celebrating. We must continue to work. One of the things that worries us is beyond the lockdown. There are going to be a lot of people who are going to be coming back into Gauteng province. We are worried about that. We are already planning about that so that the management system we have put into place at the moment for screening, for testing, for tracing contacts should not be overrun at that time. So we have measures that we are already putting in place to ensure that we continue with these efforts. It's too early. We must continue to work hard because we don't know when we will reach the peak. So thank you very much for being able to give us an opportunity to do this briefing. I would like us to give particularly Dr. Masuku an opportunity to explain a few things as a medical practitioner, and we can take questions. MEC Lisufi and MEC Mazbuko will be able to answer questions that have to do with their area of work, which is tremendous work. I want to thank them for the work they have been doing as part of Team Gauteng. The entire executive has been doing tremendous work under difficult conditions from where they are to support the work of our public service workers in the health services and in the security services to ensure that Gauteng province cannot slow down. We remain the epicenter and we must do more even in terms of screening. Those numbers are still too small. Even in terms of out of screening test, we will know who to test. We must do more in tracing. We don't want a backlog in tracing in this regard. Dr. Masuku, over to you. You can speak from where you are sitting.
Thank you, Premier, and good day, everyone. There are a few areas that we just need to clarify and make sure that we are on one understanding and we all understand the whole concepts together. And some of them I will re-emphasize because these are concepts that sometimes we tend to confuse. I will start with the the appreciation of the support that the department and I think of health is getting from the Premier and the whole executive. It's an important support. I think as a Department of Health, we are quite grateful of everything that we've been offered and the support that we're getting from everyone. The issue of screening, it's an important aspect which we did launch last time, I think almost a week ago in Alexander, as the Premier has indicated. The aim is to increase the uptake, to increase the numbers of the citizens that are going to be screened, and why we need to do screening and testing. In ordinarily, we normally, when we talk about testing, we normally include screening in the whole process. But I think for the purpose of us explaining better is that screening is one important aspect that leads to testing, and it makes it easier for us to be able to identify a particular individual that needs to be tested. And with screening, it comes on almost 3 to 4 folds, which includes one, history. And in this regard, we are talking about history of contact or history of exposure to the person who's infected or history of exposure to the virus. That's an important aspect of the history. The second part of the screening will be about symptoms. And symptoms is the symptoms that we've been talking about: sore throat, dry cough, body pain, and sometimes a bit of diarrhea and fever. So those are symptoms that are important that we need to also to look for. And then the last part is when we actually examine you and we get a high temperature, which is a fever. It does actually symbolizes fever. So if the screening identifies you as a particular patient or person that needs to be investigated further and to be done a test, then it will take you there. We are hoping that after the approval of the rapid test kits, as we are waiting for the approval from SAPRA, it will then add into part of the screening, and which will make the screening uptake for testing quite easy and quite sensitive and specific for the people that we have to test. Currently, we have ramped up our screening. We have already done close to 26,000 screens. We have screened more than 26,000 people, and we have tested more than 400 people. And in that regard, we are still hoping that we have to do more. With a population of 15.2 million people in Gauteng, it means there's still a lot of actual screening that has to be done. You'd recall yesterday we're part of the team that went to visit one of the correctional service facilities here in Johannesburg. They are also part of the screening, and it's also part of identifying those who are actual high risk. So the screening and testing is also linked to areas which have got high density or high number of people who are infected and high people who are contacts who have been exposed actually to the virus. That's also how we identify where we are going to activate the mass screening that we have seen in Alexander. And particularly, we are interested in areas of high vulnerability where we know that when we get a high number of people who are infected in those areas, we might have a bit of a bigger difficulty. So even in terms of mass actual screening, we are also including the areas which are high areas of high vulnerability and areas of high density, so that we are able to cover those particular areas. It's important for us to do the mass actual screening because it gives us a better sense of the prevalence of the disease in the population of South Africa. So the mass actual screening has been part of the important part of actually tracing. And tracing of contacts is one of those that we cannot even fathom us getting to a point where we do mass screening when the known contacts have not been actually been contacted. So we need to trace the known contacts, and we need to increase. Currently, we're on 90%, and I think to make the mass screening more effective, it will be when we have covered all the known contacts, and clearly it's something that we are on our way in doing. And we had a situation in Duduza and Alex, and those clinics are clinics that had to undergo what we normally call scrubbing down, which is a process of disinfection that we normally do. It's a process that we do in some of our theaters, in our facilities, or in our wards where they've been exposed to actually an infective individual in that regard. But we also had to even say it to our metro, to our municipalities, that some of the decisions to close institutions or to close facilities, it must be a decision of the provincial command. It must not be a decision of the municipality. And hence we have developed a guideline in that regard. But disinfection is an important aspect in that regard. And with Alex is that all the contacts in Duduza, all the contacts have been traced of those health workers that have been found to be positive, and we are quite confident that we are able to maintain and contain the infection in those areas, and we are hoping to increase the aspects of the facilities actually running. The issue is that we cannot see or foresee where facilities will be closed because of the exposure, but the issue of disinfection of those facilities is an important aspect of the work that we do. We also just want to cover the issue of recoveries. You know, you would realize that there are patients that have been noted that they've recovered, but you see, the understanding becomes a bit difficult when we only use one dimension of recovery, which only relates to a patient who have tested negative after the 14-day period of the incubation or of the infection. We know that the general process of the disease, that after 14 days, an individual who has been infected is likely to test negative, because the viral particles, they start to be shedded, and your antibodies as an individual who's infected would have overcome the infection. So that one dimension is important, that people do test negative after the 14 days, and we have seen quite a number of them. The minister has reported 45. I think with us informing him and informing the NECD, the number will be actually going up. This morning we spent the whole, one of the hospitals we visited was Kalafong. We also met the health worker who was diagnosed COVID positive 2 weeks ago. She's back at work, and she's now symptomless, and she has tested negative with her partner, and we are quite grateful that she's also willing to talk to the media and to the public about her episode of being an infected individual and how it will carry on going forward. And the issue again about it is that people who normally are infected, they will have some symptoms, and when the symptoms disappear or they disappear, it makes it easier for us to even determine that this is part of recovery. So we want to also include certain levels and certain dimensions of recovery, instead of us just relying on the test itself. So even symptoms, people who improve from symptoms, when you start off having a cough and the cough disappears, or you have a sore throat and the sore throat disappears, or you had a fever disappears, also that is form part of the process leading towards full recovery, or leading towards a negative test results going forward. But recoveries are there, and the other issue with recoveries is the issue of the stigma, which the Premier spoke about, that most of the individuals had actually had a problem of coming out to even talk about their status being positive because of the stigma that we have seen. We have seen an incident in one of the suburbs in the northern Johannesburg, where an individual who was COVID positive was thrown out by the landlord because of that status. There's a gated community also. They threatened and they harassed an individual that was COVID positive in their area. And it's something that worries us big time as the government, because we also don't want the stigma to be the one that rules us and even governs the community. But the community must use the facts, must also get around the issue of the myth. So in terms of recoveries, we are doing well. People are recovering and they have got improved symptoms. And we have been lucky that most of our patients who have been COVID positive have not required hospitalization. Currently, we are sitting with, in public sector, we are sitting with 2 patients who are in ICU, in hospital, and they are improving in terms of their actual status. In private, we've got 5 who are in ICU, and these are patients that, when we talk about hospitalization, these are patients that we are looking after. The majority of the patients are at home or they're in isolation wards. We are continuously creating the capacity to, like we have been reporting all along, we have successfully decanted Tshwane District Hospital to become a designated hospital for COVID in Tshwane. It has got 240 beds, and those beds are quite important for us, and we went there to view them today, and we were able to make sure that we were able to get them actually ready. Currently, they only have 1 patient there who's in ICU, the one that I've spoken about, one of those that I've spoken about, and the institution is quite ready, and it's one of those swift actions that we have taken in creating internal capacity within our system. We are also doing the same in Chris Hani Bara and Charlotte Maxeke, and we also went to Kalafong. They've got a ward that is almost ready to be used, which is going to house close to 26 patients for isolation and for ICU. It's a ward that was renovated over the years, but we have rapidly moved in terms of activating its function. It's also one of those facilities that are actually ready for hospitalization. PPE, the Premier has spoken about it. I think here we should say, Premier, that no official or administrator of any facility must insist on our health workers working without proper protection. But still, in the same vein, we need to say that it's not everyone who will get the same type of protection throughout, because those who are working in the wards interacting with confirmed positive patients will have a different PPE. Those who are at the forefront, who are triaging, they will have a different PPE. Those who are doing screening, they will have the same, they will have also their own. So not everyone will have a similar PPE throughout. And to also add to this thing, to this issue, is that without following any other of the golden rules that we have spoken about of washing hands, cough etiquette, sanitizing your hands, avoiding contact and so on, and even touching your face. Those are things that even if you can wear a PPE, if you don't observe those golden rules, PPE might not even work for you. But we also want to say that for the masks and others, we'd like that the public themselves must give us an opportunity as healthcare that those masks must be put aside and be used by healthcare workers. And then it's something that we need to start talking about in public, because you can't have a situation where nurses and doctors won't be having masks, but the public, or because the public will be having more masks than our health care workers. We also have got, maybe the last issue on PPE is that the hotline that we have launched to make sure that every healthcare worker has got an opportunity to report directly to the command council, the provincial command council, when they don't have PPE. It's up and running, and it's the one that we use so that it bypasses officials of facilities or facility managers. The number that would be publicized in our social media platforms, it's 066 494 6192. 066 494 6192. So this is a WhatsApp number that is 24 hours for our healthcare workers to use to have to report when they are running out of PPE. And it's something that we also have moved in that regard. And we are also grateful that the stocks that we have piled up for the past 2 weeks has actually reached. We are still continuing receiving more stocks. We received a generous donation from the Motsepe Foundation during the week, who donated N95 masks to us, and they are still going to donate more of the PPE. So our preoccupation and prioritization in this fight on the pandemic is just to make sure that our healthcare workers are protected fully and they have enough actually to protect themselves. And we are in a great sense grateful for them being there, but we must also as a public support them. And I think one way of supporting our healthcare workers is just to not use the masks in vain, and we must use it when there is a particular need. The best thing to do is just to continue with the golden rules and also avoiding overcrowded places and make sure that there is enough social distance. In that light, Premier, I think we've tried to cover most of the things that are important. The flu vaccines, those who've got medical aids, it's important that you get your flu vaccines. The ones that we have as government, we are continuously giving it to our elderly patients and also to our pregnant women and children and our healthcare workers, because we also need to actually protect them from the flu season as it is actually upon us, and it helps us to lessen the burden in our facilities and lessen the demand of healthcare if the flu is not rampant without the vaccine. And thank you.
Thank you, Premier and MECs. We'll now take questions. We'll start here. Over there. Just come here and speak through the mic, if you don't mind, please. No, the system wants to pick you up. It can only pick up from the mic.
Thank you. Nozindombi Mia from SABC TV News. I have 2 questions. The first question, how many people have been arrested in the roadblocks and that have been stepped up in this week? And for the health MEC, you touched on the issue about Alex, but we understand that there is a healthcare worker at the Masakani clinic who tested positive. What measures were put in place to ensure the safety of staff and patients in Alex? If you could give clarity on that. Thank you.
All right. Are there any more questions? Okay, nothing. Let me just check. We did receive a few through the WhatsApp system. Good. Okay, I think, just a few questions. One from Netwerk24, Christian Duplessis. How many infected patients are being treated at state hospitals, private hospitals? And I think Dr. Masuku has answered those. How many of the infected patients are in a critical condition? How many tests have been carried out in communities? That has also been provided for in the statement. How many people have tested positive in communities? How many people have tested negative in communities? And then another question from Rapport. How many people have been tested in Gauteng so far? I think it's a similar question. Secondly, what will the province's input be if asked for a possible extension? I think let's leave that to the authorities that are dealing with that. Then another question from Eyewitness News. Where is the epicenter? We did say that in the statement. What are the test results from Alex? Again, that has been provided. When will the informal settlements are the informal settlements being moved? Target numbers of tests per day in the province, and how many people have done tests in the province? I think we've dealt with that one also. Is it too early to suggest an ending of lockdown? Again, that I'm sure will be dealt with by the President and the National Command Council. There's another question from Nikele, which basically talks about the number of people who are still not adhering to the lockdown regulations. I'm sure the MECs or the Premier can comment on that. Those were the questions. The technicians have requested that we speak from the lectern, Premier, so the MECs can proceed to answer.
Thank you very much for the questions. Mine, I think it's only one. I'm not sure if Premier will respond to it. On the number of people that have been arrested, as the province, it's only national that releases the statistics, so we don't release the numbers after they've been audited. But I must indicate that various people have been arrested for various offenses, such as your illegal trading of alcohol, general non-compliance with lockdown, and taxi drivers that have overloaded and not complying to the 70% that was outlined by the minister. And the ongoing Okaimolao operations are also ongoing. Even this morning, their statistics were actually released of people that have been arrested for various offenses, including gender-based violence, and other people that do all the wrong things. Those that have been arrested at roadblocks, sometimes others, they seem not to understand that when you get to a roadblock, what it is that we are supposed to produce. Others are not carrying their correct permits. Those that want to cross into other provinces, either going for a funeral or going for other emergencies, they have to produce those documents or the permit that indicates that. Other than that, they then get sent back. And those that refuse to comply, they then get arrested in line with the Disaster Management Act. So the police stations almost alongside our various borders like Heidelberg, your Vereeniging, Davidton, Twatwa, those are the ones that so far, some of those that have been arrested are actually kept. Thank you very much. There's been a lot of burglaries in our schools. I must indicate that from yesterday, after various investigations were done on the burning of schools in Soshangove, 2 people have been arrested for questioning. There's been burglaries in clinics. I'm not sure what bafuna in a clinic or bafuna mapilisi. We don't know what it is they're looking for. But those burglaries also the police are investigating. And as and when more and more information we get, we'll be able to share with you of all those people that have been arrested. And remember, because they can't go to court because courts are non-functional for now, but I'm 100% sure we'll be able to share with you who and where are some of those people that have been arrested. Danke siyabonga.
Thank you for the questions. I think most of them had been covered on the statement, particularly in terms of the number of tests that have been done since we started. Particularly, we started calculating and making our tracking of the numbers from the 7th, and I think we moved from 6,000 on the 7th to 26 over a day of period. So we are certain that we are going to do a number of tests over 100,000 over this period of this weekend. And I think the issue of the community testing, it becomes important, like I've said, that we in a real sense need to determine the prevalence of infection, particularly in areas which of high vulnerability and high density. And we did indicate that the epicenter in Gauteng is Johannesburg. It has got a high number of infected individuals, and we also have been able to trace and track all the contacts of those individuals, and we are quite close to making sure that we are on 900% for the tracing. And the informal settlements are a big concern, and hence we do have a number of satellite testing sites in the informal settlements. And I think one thing that is important that one needs to mention is that the lockdown has helped us a lot just to reduce the rate of transmission. Just the closure of borders itself, the border of the OR Tambo, the port of entry in OR Tambo, the borders within the province has helped us in a great deal to reduce the rate. Hence, we saw some form of a plateau last week, but now because of the community testing that we're doing, we are starting to see that we might get another spike of the rate, and we are hoping that in determining whether the lockdown should be extended or it should be ended in the coming week, it will all be about how successful we have been in terms of community testing. In Gauteng, for 15.2 million people, we are expecting at least to cover a bit of the 20 or so, 20 to 30% of the community. But we are focusing more on areas of high vulnerability, a high number of contacts, and high number of infected individuals, so that we don't just do it randomly, but we also get focus on areas where, in a real sense, we need to get the sense of the prevalence. And maybe the last point would be, or two last points. The point on Alexander, yes, it's confirmed. It was one staff worker, health worker, who worked there. And I'm certain that we all understand that the person who works in the clinic is a health worker, whether they're a cleaner or a gardener or anything. So a person who's employed for us, it's one person that has been found to be positive, and we have been able to trace all her contacts, and all of them some of them, they are in quarantine awaiting their results. And some of them have been cleared. So we also went there, had a very lengthy discussion with the labor, and labor was also quite comfortable with the scrubbing down and the disinfection of the clinic, because we wanted the clinic to continue functioning, but undergoing that process of disinfection and also making sure we are able to get all the contacts traced. We have been on the fortunate side of things in terms of the patients that require hospitalization. At the current moment, I did mention that we've got 2 in public sector and we've got 5 in private sector. And maybe just to mention that the deaths that we have recorded in Gauteng, 2 of them have occurred in private and 1 has occurred in public. And with the death, the important thing that we also want to mention is that most of them had comorbidities comorbidities, meaning that they had an underlying actually disease, like your hypertension, diabetes. The other one had cancer. The other one was just an elderly person who actually succumbed to the disease. We are hoping that with all the measures that we are putting as a call, that maybe the Premier will have to re-emphasize that we want the regulations to be fully enforced during this period, and it will give us a good time to catch up with our screening and testing, and we're hoping that we'll be able to get a better outcome from that. Thank you.
Brief comments? Just say hi.
Just say hi.
Thank you so much, Premier, colleagues. I think let's start with the homeless. We just want to thank all the municipalities that worked with us to ensure that we accommodate all the homeless people within our province, in particular the municipality of Tshwane. I want to confirm to Honorable Premier, we now have government in Tshwane. The work that that municipality has provided, it's truly, truly appreciated, and want to thank them. We also want to thank the NGOs that are currently accommodating additional people, and we also want to thank our social partners that provided all the relevant food that was needed so that we can give to the people of our province. The Premier went through the details of the food that we've allocated. We continue to allocate that food at an average of almost 2,000 per day, that we make allocations across the entire province for those that need assistance. Our email still works, so anyone that feels that there's somebody that is in need and that we have not managed to reach that particular individual, you can just send an email at support@gauteng.gov.za. That's support@gauteng.gov.za. Within 48 hours, we then do the screening, and if the person qualifies, we utilize our regional food banks to distribute food to that community. I also want to touch on the education aspect, that indeed we are accelerating our work through online education and also in providing lesson plans to families that can assist in ensuring that their children are given the necessary support. Our commitment is clear. No one will be disadvantaged because of the coronavirus that we find ourselves in. Our commitment is that when the schools are reopened, when the President announced the date in which the schools will be reopened, we'll ensure that we provide all support to all learners, so that there must be no advantage of those that have access to online to say, we don't want a repeat class because we know the lesson. We want all our children to be treated the same and be given the necessary support. Through the Ministry of Basic Education, we've been coordinating and exchanging resources amongst ourselves in the country so that no province is left behind. So our commitment still stands. We want to appreciate and thank law enforcement agencies, in particular the SAPS and the community safety led by our MEC here, for apprehending 2 suspects that we really believe that might give us information that will assist us to know why people are burning our schools in Soshanguve. So those 2 people that have been arrested, we really believe they will sing, and this will assist us to deal with this aspect. It's just unfortunate that the number of schools burglaries have now jumped from 18 to 40 in the last 48 hours. We now have 40 schools that have been attacked by those that we don't know why they're attacking our schools. In conclusion, we also want to thank the institutions that continue to provide academic support outside government. There are institutions that on their own, it can be former educators, it can be NGOs, or it can be bodies that have material that assist in education. Those institutions have continued to offer education, and we want to thank those institutions. Thank you so much. Thanks, man.
Essentially, the concluding question that has been asked, which we are not able to deal with now, is what happens after the 16th. That question can only be answered at a national level. I know that the president is continuously consulting with the premiers, and the Minister of Culture regularly consulting with the mayors. The assessment of where we are is something that will inform the decision that will be made by the National Command Council and communicated by the President. I think all I can say to you is that it will be a profound mistake to think that these numbers where we are now represents where we might be. It is important, the message that the Minister of Health sent out, that this may just be the calm before the storm, is the best way to deal with this situation. We think we should really prepare for the situation that might go way above where we are now, and we have to be ready for that. Our province is the epicenter. We know that once you open the airport, once you open the borders, you're creating big pressure for us to be able to deal with this situation. But there will also be other assessments that will be made, what the impact on our people will be at each given moment, assessing what the gains are, the gains in terms of keeping the infections much lower and curbing the spread and flattening the curve, and the impact around the well-being of people. So I'm confident. I've absolute confidence, as I've said, in our president. When we look at other nations, what they are going through, as South Africans, we should be happy that we have a president who is proactive, who also consults, who takes the best interest of our nation at heart, and leave out all the other political things. Even in this province, I must thank all the political parties that are represented in our legislature. Yesterday, we did the last briefing session with them. All of them are working with us. They are working with the government, the religious sector, the faith-based organizations, the NGOs, the foundations. All of them are working with us. So far in South Africa is good because COVID-19 is not being politicized. All of us are confronting it as an existential crisis, as something that threatens the survival of humanity, and that all of us must face up to it. That's what we are happy about. So when that time comes to assess where things are, I'm confident that the leadership of our nation will make the correct decisions that are in the best interest of our country, and we as a province will make an input in that decision-making process. I want to continue to warn, we must not be complacent. We are far from the peak. We must continue to observe social and physical distancing, even under unique, different difficult situations. We must enforce the rules as they are now. It is not time to think that we have overcome, especially because we are getting into winter. We are all very vulnerable. But we will be guided by our president. And we are confident he'll make, together with our national cabinet, the best decisions will be made for this country. So far, so good. We have good leadership. We don't have nightmares about about the leadership of our nation. We have good leadership. Thank you very much.
Okay, thank you, Premier and MECs. This brings us to the end.
In the coming days, government will be rolling out a screening, testing, tracing, and medical management program on a huge scale. Around 10,000 field workers at the moment will be visiting homes in villages, in towns and cities to screen residents for the coronavirus symptoms. People with symptoms will be referred to local clinics or mobile clinics for testing. People who are infected with the coronavirus but who have no or moderate symptoms will remain in isolation at home or at a facility provided by government, and those with severe symptoms will be transferred to hospitals.
Well, good evening and welcome. South Africa has made it through the halfway mark of the 21-day lockdown aimed at curbing the rapid spread of COVID-19. And the last few days have proven difficult for social distancing for especially poor South Africans and those living in dire conditions. Lack of space, shortage of food, and the challenge of keeping young children engaged in confined spaces have been hard to tackle. As an unintended consequence, the rest of the population have also been seen a significant reduction in crime, but domestic violence has increased sporadically despite strides made in a bid to contain the virus. Experts say the total number of people testing positive for the coronavirus in the country is an underestimate of the burden of COVID-19. Experts say the number of confirmed cases is lower than the number of total cases due to the limited and/or restrictive testing criteria. Over 1 million people worldwide have been infected with the disease and more than 54,000 have since died. South Africa has this week intensified its campaign to test as many people as possible. Some of the priority areas for action included upscaling countrywide diagnostic capacity, safety and protection of frontline healthcare personnel, increasing access to mandatory flu vaccination, and so on and so forth. But our guest tonight is ophthalmologist Dr. Khosi Letlape. He'll be joining us later on the show. He's also a leader in medical circles, as well as Professor of Vaccinology at Wits University, Professor Shabir Mahdi. He's also the Director of the Medical Research Council, Respiratory and Meningeal Pathogens Research Unit. Professor, very good evening and thank you so much for joining us. Have we done enough to mitigate the impact of COVID-19? That's our question for tonight on Unfiltered. And you're welcome to join us in this discussion on Facebook and Twitter using our hashtags at SABC News Online and SABC News Unfiltered. Professor, let's bring you into the conversation. Thank you so much for joining us this evening as we reach the halfway mark for the 21-day nationwide lockdown. South Africans are a bit uneasy about the detail and the efficacy and the possible extension of the lockdown. What is your assessment of the movement of the curve as the infection rate approaches the 1,700 mark?
Okay, so good evening and thank you for having me. So I think the reality of the situation in South Africa currently is that we really don't have a good handle in terms of the true number of individuals that have been infected. Unfortunately, because of a variety of reasons, our ability to actually reach out into communities to do testing at scale has been very limited. In fact, if you look at the number of individuals that have been tested in South Africa up to now, it's just over the 50,000 mark. Whereas what we should be doing is aspiring towards testing close to between 30 and 35,000 people per day to really get a good idea in terms of the extent of the circulation. Now, with all of the constraints that have existed in terms of being able to test, like I said, it's really difficult to actually figure out exactly how bad the circulation of the virus is in the country, as well as how many people have been infected. That being said, I think it's important also to recognize that South Africa is not unique in this regard. Even high-income countries such as Italy, such as Spain, have very much underestimated the true number of individuals that have been infected. In fact, the data suggests that in a place such as Italy, which has reported over 100,000 cases that have been confirmed, as many as 5 million individuals might already have been infected up to now. So we do have major limitations in terms of the amount of testing that's been done to be able to really quantify as to what sort of inroads we've made in terms of containing the circulation of the virus.
You actually quoted in a health expert article titled "There's an urgent need to upscale COVID-19 testing facilities," where you say the total number of people testing positive for the deadly virus in South Africa is an underestimate of the burden of COVID-19. And I'm going to ask you to think about just unpacking that for us, just as we introduce our other guest, Dr. Letlape. Thank you so much for joining us this evening. The last time we spoke to you, we were encouraging South Africans to social distance, to just go a notch up in terms of their hygiene, and there wasn't a lockdown then. Since then, do you think there's an improvement?
Yes, I think there's increased awareness now about the importance of hygiene. And unfortunately, because of an uneven society, we're not talking to all South Africans. As become evident, some of our communities are only getting the news now about corona, and we need to do more to educate all South Africans about the pandemic that we are dealing with.
Dr. Madu, let's just get back to you just in terms of what do you mean when you say the current figures are an underestimate of the burden of COVID-19 at the moment?
Okay, so there's multiple layers to it, but I think the most important aspect of it is for us to be able to get a good understanding in terms of the true number of individuals that have been infected. We need to have a very low threshold at which we actually investigate individuals. Unfortunately, until very recently, that threshold was really geared towards identifying individuals that had a travel history or were in contact with someone that was known to be infectious. So what I'm saying is that what we need to do, and this is what the President announced a few days ago, is we need to go down to the communities, down to the street level, to be able to investigate at each house in terms of which individuals might be manifesting symptoms of a respiratory viral infection, and those individuals then need to be tested. So where should we be with testing? A good example in terms of successful interventions in containing the epidemic comes from South Korea, where during the period of circulation of the virus at its peak, what they were able to do is test roughly one individual for every 150 people in that particular population. Currently in South Africa, we're testing 8 individuals for every 10,000 of the population, which is completely suboptimal. So in the absence of us actually scaling up our testing and doing it at the community level, down to each household almost, we're not going to be able to quantify the true extent of the circulation of the virus, as well as the true extent in terms of the number of individuals that have been infected currently. What we're already seeing emerge, unfortunately, in our hospitals, and a good example is the hospital in KwaZulu-Natal over the weekend, where 27 healthcare workers were infected because of one case that wasn't actually recognized as being a possible case of COVID. So under those sort of scenarios, what we're facing is essentially community circulation of virus, which is going by unnoticed, and we're only picking it up when the healthcare workers, as an example, are becoming infected, which is suboptimal.
Dr. Letlape, I don't know, do you agree? Although the infection rates are going up, South Africa has been praised for having one of the lowest mortality rates in terms of COVID. Is it too early to tell?
And we have to understand that the attack from Gauteng. It is important to see how so that those that are affected need to be isolated. But the aim should always be to stop the spreading of the infection. Now, hygiene becomes important.
All right, Dr. Letlape, I'm going to ask our producers to clear up your line.
Not replace each other. They should be synergistic. So we need to forge ahead and do more.
All right, I'm going to ask our producers to clear up Dr. Letlape's line so that we're able to tell, especially for the benefit of our viewers, exactly what he's saying. But Professor Mahdi, let's come back to this concerns about the so-called 1 in 4 people who are asymptomatic carriers but are still able to transmit the virus. Is this the case, and how contagious are these people?
Yeah, so that's really unfortunate in that over the past week or so, we've learned much more about the virus compared to in the past. And what we've come now to recognize is that, in fact, individuals that are completely asymptomatic, or even some individuals that are what we call pre-symptomatic, that is before they start manifesting any symptoms of the infection itself, they actually seem to be able to spread the virus through contaminated droplets, even simply by speaking to other individuals in the immediate vicinity. They could infect those individuals, or they could actually contaminate the environment with the droplets. So this, unfortunately, is of great concern because it tells us that by targeting symptomatic individuals, it's important to isolate those known cases. But in addition to that, there possibly is a large pool of individuals that are infected that we would never know that they're infected unless we test every individual, which obviously is not pragmatic for multiple reasons. So the additional knowledge in terms of the possibility of these asymptomatic individuals being able to be able to transmit the virus in the community is something of major concern. And that's the reason why different organizations are reconsidering some sort of strategies, especially as an example, the use of face masks when people go out into public spaces.
Dr. Letlape, the practicality of testing more than 50 million South Africans, is this achievable?
I think the aim is not to try and test everyone, because the cost implications will be quite high and the time that you need. But the important thing is contact tracing and ensuring that people that have been in contact with a person that's known to have COVID or that's suspected of COVID can be tested, can be traced, and should be tested so that we see how far it is spread. We're still not in the realm of trying to give everybody a test. That would be difficult. Tests are also not readily available. The different nations are competing for the number of tests that are available. Testing materials are quite scarce. So even though testing is important, containment of the disease and the hygiene measures are also critically important. But more importantly, it's compliance of citizens. If you've been in contact with someone, if you've had a test being done and you're awaiting results, please do not move. If you're found to be positive, don't become a vector and start moving from the area that you are in. Give a complete list of the contacts of people that you've been in touch with, and testing will be confined to those people that are traced to have been in contact with someone that is positive. We can't aim to test 53 million people. But people have to understand this. Compliance with what has been communicated, compliance with the lockdown, hygiene is extremely important. Physical distancing is a key to winning this issue. And as my colleague said, because of asymptomatic spread and people that start shedding the virus and spreading it before they even show any symptoms, it's important that when we go outside, we cover our nose and mouth. But what is important is that we should not compete with the healthcare setting for surgical masks. Just cloth masks for going out, but that is to ensure that if you are one of those that might be carrying COVID and you are not symptomatic and you are not aware, by covering your nose and mouth, you are reducing the opportunities and the chances for you transmitting it to others. You are basically
protecting others rather than protecting yourself. And it's time we go back to being altruistic. And if we come up with the attitude of how do I ensure that I protect others from me, then we will be protecting each other.
I'm glad you're bringing up the issue about cloth masks. We'll talk about that after the break. And I'd also like both of you to think about the strategy of government in terms of how they're rolling out the door-to-door testing. Let's take a break for now. You're watching Unfiltered.
As government, we are aware that the lockdown has caused great disruption to all our lives and caused upheaval in our economy. But we all know and agree that this nationwide lockdown is absolutely necessary to save the lives of thousands, even tens of thousands of our people. Coronavirus pandemic. It infects the rich and the poor, the young and the old, black and white, those who live in the cities and those who live in the rural areas. Let us not make the mistake of thinking that this is somebody else's problem.
Welcome back. You're watching Unfiltered, and our conversation tonight about the rolling out of those mobile testing stations by government. Our conversation tonight with Professor Shabir Mahdi. He's a vaccinologist at the University of Witwatersrand. He's also with the South African Medical Research Council, and we're also in conversation with Dr. Khosi Letlabe. Thank you once again, gentlemen, for joining us this evening. Let's just try and unpack that strategy by government. But before we do that, let's take a listen to a few voice notes that our viewers have sent us tonight.
Yes, I do believe they are forced to shut and lock the whole country, because if they don't do so, a lot of people will die while the dead is rising. It's no longer the same as it was again. So there is no need to allow people to go around and so on. They need to close everything, shut it down. Simple as that. They are forced to do so.
I think failure to extend the lockdown will really defeat the objectives of lockdown, because that we are going to see a very huge number of new cases going up, and that will take us back to square one. So it would be advisable for the president to extend the lockdown period.
For our president to make an extension on a lockdown, okay, it might be a good idea, but let's not forget that it might cost a big knock on the companies, which might result in retrenchments. And the fact that our economy is limping at the moment, it might cost a big knock on our economy.
I personally think that the lockdown should be extended. This might be a tough decision, but it's the best decision to take in the best interest of public health. Yes, the government is to come up with various ways of bailing out the economy, and the government should also consider making sure that there are adequate and constant food supplies and medical supplies to the citizens.
Very important contributions there. We really appreciate them, but we just want to know who we're talking to. So as you send those in, please let us know who you are and where you're calling from. But let me just bring in my guests once again. And Professor Mahdi, I will start with you. That conversation with our viewers that we're having tonight about fears of a possible extension of the lockdown. Should the lockdown be extended?
Look, it's early days to tell, but I think the important message here is that a lockdown on its own does not get rid of the virus. What the lockdown achieves is that it firstly limits the circulation of the virus to individuals. But the main reason for the lockdown is for us to become much more efficient, which we go about, identify individuals in every household that might be infected. and then test those individuals and put them into isolation and put the context of those individuals under quarantine and observe them to make sure that they have not become infected. In the absence of actually doing that, a lockdown, in fact, will achieve very little. And that is one of the Achilles heels in terms of our current approach to the lockdown, is that we haven't been able to scale up testing to the extent that we need to test. So again, a lockdown on its own, irrespective of whether it's for 3 weeks or 5 weeks, in the absence of actually being able to identify cases at a household level, put those individuals under isolation, quarantine other members in that household, it's really not going to achieve much. If anything, what would happen is that after this lockdown is actually lifted, in absence of us having put into place the strategy of test, isolation and quarantine, what we would probably see is a marked rebound in terms of the number of cases and an acceleration in terms of the number of cases. So it's not so much a matter as to how long the lockdown should last. It's really an issue as to what we actually do during the context of that lockdown in terms of being able to identify the infectious cases, to try to bring about an interruption. The other reason for the lockdown is what we're also trying to do is sort of spread out the cases that occur over a much more prolonged period of time. And that would basically assist our healthcare facilities in being able to cope with the added demand that's going to exist when we start seeing more cases of community transmission